Good afternoon. Now I will start speaking introduction. Okay, first you will have 3 minutes. 3 minutes warm-up session. Okay, and this will not be assist. Okay, he will start to ask you, what's your name? What's your profession? And how long have you been working as a physician? What about your working hours? And all of these questions will be in the 3 minutes warm-up session, okay? Then he will start giving you the card. He will cut the card of the patient for himself and the card of the patient, of the doctor for you, okay? You will have 2 cards, okay? 2 stations, okay? 2 cards by 2 stations. This all speaking, all about speaking, okay? You have to be oriented with the following: introduction, sympathy and history, diagnosis, management, reassurance, reluctant patient, checking understanding, signposting, and ending, summarizing, and special cases, okay? Introduction, you will have 2 scenarios, okay? 2 scenarios. The first scenario is that this your first patient. You have to ask the patient, what's your name? Okay, the second one is a follow-up visit. The follow-up visit, so you have to be familiar with the patient. Don't ask about his name. Okay, you will say, good afternoon, my name is Dr. Reda. I'm here, I'm the treating doctor for today. How can I help you? Or in the first example, you can say, how can I address you? Then he will tell you about his name. But follow-up visit, you will tell him, good afternoon, nice to meet you again. How are you so far? It's been a while. How can I help you? Okay, so he will start by giving you a bad complaint. Okay, so you have to start with sympathy. After he tell you, oh, I have a headache 2 days ago, or I have been suffering from severe headache over the past 2 days. You have to show sympathy. You will tell him, oh, I'm really sorry to hear that. It must be very painful for you. Whatever of all of these examples. So he will give you the complaint, okay? Then you will give him sympathy, information, then reassurance. Sympathy, information, and then reassurance. Don't forget. Okay, the sympathy will be like this. Oh, I'm really sorry to hear that. Or, I really appreciate your concern. Or, I really appreciate your fears, your worries. Would you mind if I ask you few further questions regarding your complaint? Okay, so you will ask about the history like a doctor, about the symptoms. If it's pain, you will ask about secrets, site onset, character, radiation, associated symptoms, timing, severity, and exacerbating and relieving factors. You will ask as any doctor, and I will show you in the card. About the site, the duration. So you will end history taking by asking, have you visited any GP for this condition? Have you tried any medication for this? Is there anything else that is bothering you? Whatever, you will end, you will finish your history taking. Then you will ask him to make examination. You will ask him, would you mind if I examine you, please? He will tell you, no problem. Okay. So after that, you will take a second of silence and then tell him, well, based on your symptoms and upon examination, I believe that you have what is called whatever. your diagnosis will be here. Okay, so this diagnosis you have to tell him in layman language. After giving the medical term, you can ask him, have you heard of this before? Whatever. Okay, I will check you are following. Okay, anyone has any problem, please click on chat and start to make his question. Okay, so you will uh, here you will tell him your diagnosis. Okay, and you will clarify all about diagnosis in layman language, not medical term. You just tell diabetes mellitus like this, and let me explain you what is the meaning, or what is the definition of this disease. Okay, it is a condition caused by blah blah blah, and the symptoms include whatever, and the best treatment would be your treatment. Okay, don't worry, the interlocutor is not a doctor. Okay, and you will not be assessed against any medical knowledge. Okay, just clinical skills. Okay, so don't worry. What is the management? Okay, you will tell him, I think we would start with, or I will give you a prescription for, or you will tell him, first of all, it's also important to, and you report your instructions. Okay, there are some very effective strategies to cope with this. I'd like to explain them for you. Okay, I see it must be a very difficult situation for you, but the good news is that there are several options available which will help you. Okay, all of this will be clear. Don't worry regarding all of this. You will speak, you will pronounce right or wrong, whatever your medical informations are right or wrong, whatever. The examiner will not be a doctor. Don't worry. This is language test, not medical proficiency test. Okay, you can ask excess information. Okay, it will not be wrong. Okay, excess informations will not be wrong. You can increase, you can elongate, but between each three sentences you should check understanding. You will tell him, are you following me? Am I clear so far? Do you think you can do that? All of this interruptional sentences, you should check understanding of the patient. I am not expert in English language. You are not expert in English language, but I got 4 B's. Okay, and many Dr. Badr gets 3 A's and C plus writing. You will get A and you will get B. Don't worry. Regarding your medical knowledge will not be assessed. Your pronunciation will not be assessed. You will be assessed how you will treat with the patient, and especially if this patient is reluctant against your instructions. Okay, then you have to reassure the patient, as we have mentioned, that you will show sympathy, tell him the information bullet, then reassure him. Don't leave him blind, and even he is reluctant for you. Okay, you will tell him, rest reassured. Let me reassure you that this is a self-limiting disease. Don't worry. Okay, nothing to be worried about. I know it sounds difficult for you at first, but with practice, I am sure you will be able to do that. Okay, I'm sure you won't have any more trouble. Don't worry, you are in good hands. The staff here are very experienced and well trained to deal with such situations. So you have to vary your sentences. Don't repeat a specific sentence. This will be wrong. Okay. Okay. Don't treat with a reluctant patient as you are the doctor and you are the patient and I am the doctor. No. Try to be skilled one in treatment with your patient, in dealing with a reluctant patient. You have to appreciate his words, okay, his fears, his concerns. You will tell him, I really appreciate that you refuse this because blah 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 blah. I can understand your words. I know how you feel, but let me explain more to you. It will be difficult at first, but later on it will be easier than you expect. I completely understand your busy time, but your health is my priority. What's more important, your health or your job? Okay, you will try to convince him by many ways of convention. Okay, let me reassure you, if you follow my advice or if you follow my instructions, the risk of this disease will be greatly reduced. So, if you follow my instructions, the heart attack will be greatly reduced. However, if you don't, it will be a problem. Okay, speak whatever you will speak. Be easy in speaking. Don't try to correct each mistake you make, even in grammar. Don't worry. Okay, you will get B definitely in speaking, I'm sure. Okay, inshallah, you will get B in speaking. Let me explain to you why the insulin therapy is necessary for you. Okay, according to the last guidelines, whatever you will say, it will not be wrong medically, even medically wrong. It will be not wrong in occupational English test. Okay. Finally, after your agreement, I am pleased to hear that. I will see. Do you have any other concerns? Okay, thank you. I will see you in a couple of weeks. Thank you. Thank you. This is the end. But we said that each 2 to 3 sentences, you will ask the patient. Is that clear so far? Do you think do you think that you can do that? Do you have any questions so far? Would you like me to tell you more about this? Okay. What's signposting? You will tell him, first of all, as I said before, as I have mentioned before, I recommended that. I strongly advise you. It's a good idea to refer you to a physiotherapist, whatever. Okay. You will end. Do you have any more questions? Hope you feel better soon. I'd like to see you in a couple of weeks. Don't hesitate to call me if you have any concerns or if you have any queries. Should there be any queries, please contact me. Thank you. By this way, you will get A to B in speaking. Don't worry, it will be like this. Next time, we will discuss special cases about breaking bad news, referral to a dietitian, referral to a physiotherapist, quit smoking, alcohol cessation or alcohol addiction, starting insulin and exercise and all of this. We will start now doing this. I will open mic for you. Anyone will raise his hand. I will make him the carer and the other one will be a doctor. I will be the assessor, okay, to assess. I will write down my comments and all participants, please write down your feedback and comments to tell your friends. By the way, speaking is very easy. Don't waste your time in doing speaking. Just make 1 hour for speaking in each day. Every day, if you make only 1 hour with your friends for speaking, you will be perfect. Okay, just select your speaking partner and start with him. You definitely, inshallah, you will get B in speaking. It's not a problem. I got B in speaking, and all my friends who got C in other subtests, they got B in speaking. So it will not be a problem. Okay, please, who want to share with me for the doctor rule or the carer rule, please tell me and or raise your hand. Okay, Dr. Dawlat has just raised her hands. Okay. I will be the patient. Okay, Dr. Muhammad Abdel Hadi will be the patient. Okay, and Dr. Dawlat, you can be the doctor for Dr. Muhammad Abdel Hadi.
Okay.
Assalamu alaikum.
Assalam.
Alaikum salam, Dr. Dawlat. Okay, you are the doctor and Dr. Muhammad Abdel Hadi the patient. I will adjust a timer.
اوكي السلام عليكم.
عليكم السلام ورحمة الله. دكتور محمد عبد الهادي، أخبار حضرتك؟
الحمد لله. اخبار
الحمد لله.
حضرتك يا دكتور؟
الحمد لله، نشكر ربنا. الحمد لله، أنا معاكم للنهاية إن شاء الله. عايزين الناس تدخل الامتحانات وتخلص. Okay, I will speak in English. You will have only 20 to 30 days to finish occupational English test. Don't elongate the period. Occupational English test is not an exaggerated language parameters or hard language proficiency test. It's just a system. If you got this system, you would pass, inshallah. Okay, you have 3 minutes from now. Dr. Abdel Hadi, the carer, and Dr. Dawlat. Dr. Dawlat is the patient. Okay,
I am
start
the
now.
patient or the doctor?
You are the doctor, and Dr. Abdel Hadi, Muhammad Abdel Hadi is the carer. Okay.
اوكي.
Okay, start now.
Start. Not finished the reading yet.
Three minutes to reading.
Okay.
Okay, then for the test will be 5 minutes. Go on.
دكتورة دولت I'm ready when are you ready?
No, not yet. Space concern. It is my first time. I don't know how it's going to be.
It's okay.
I'm ready. I want to ask, I suppose that I know the patient or you have to
No,
do
it's
something?
first time. You don't know me.
Oh, okay. Hello, Mr.
Okay, are you ready, Dr. Dawlat? Are you ready?
Okay, okay.
Okay, you are ready. Don't worry, don't interrupt her. Whatever if she's speaking wrong, don't interrupt her, and vice versa. Don't interrupt him. And at the end of the conversation, we will try to give you our feedback. Okay.
Okay.
Okay, go on.
Okay. Hello, Mr. Smith. What can I know? What brings you today?
Hello, my name is Adam, and my dad is Smith.
Okay, how is doing your dad?
My dad is a patient of yours. He's have a history of atrial fibrillation, and he felt yesterday, 2 days ago, and I'm here to collect his Benedict Fort.
Okay, look, I understand that. I'm sorry to hear that, but really I can't prescribe Benedict Fort without consultation.
Why? My sister have a Benedict Fort and give it to my father. I need this because he have a pain now.
Okay, I appreciate your concern about your dad, but I could explain that your dad is already taking warfarin, there is contraindication to be taken with another drug like Benedict. Do you understand me?
Yes, I understand you. Why are you not giving me the Benadine? He's well still in pain. I cannot tolerate this.
I understand your concern for your dad. I appreciate that, but I couldn't prescribe this drug for your dad, but I can advise you that home visit will
Why
be
you cannot prescribe me this medication?
because if you could understand that home visit will be better for your dad than just prescribe a drug for him.
Okay, but it will take a long. I'm not well standing here seeing my father suffer from a pain, and you just refusing give me the prescription. Why didn't you give me the prescription?
Because it is not recommended in your dad's situation to give him a Benadine 40 with warfarin. So if you can,
Yes, I'm with you.
yes, are you following me?
I follow you, yes.
It would be better that home visit with Mr. Harris' consent is most desirable.
So you now offer me a home visit?
Yes.
And what the home visit will help my father with?
I recommend the home visit and I really...
What will you do when you visit my dad? I know that you will be arranging a home visit, but why?
To evaluate his situation by myself and I can prescribe the suitable drugs for him.
Okay, so now I will not get the medication and there is a home visit. When that will be? Could you just make an early appointment? Because as you know, my dad is in pain. And
Yes,
I cannot let him feel in pain while I was standing.
Yes, I need just a consent and it will be soon as possible for your dad.
Okay.
Yes.
That's it?
That's it, I give up. I don't know what I can add more.
Okay.
We have finished.
It is
Okay.
long time, it seems to be long, 5 minutes.
Okay.
You are joking, guys.
I felt
What I
am
shall
far
do?
away from the light.
Are you joking? Okay.
Stop talking. Should I be in the conversation alone or what?
The words is just
Okay,
missing.
guys, doctors, please stop. We have finished Okay, we
Yes.
will let all participants give their feedback about this conversation. It was really good. No problem, whatever you told the patient or the patient told the doctor. As a patient and as a doctor, it will be we will be assessed from the participants. Anyone has any comment, please raise his hand. Okay. Okay, please, anyone give his feedback. Has anyone got a feedback to comment with? Okay, I will let Dr. Dawlat comment. Okay, Dr. Ahmed Aid. Okay, here you are, Dr. Ahmed Aid. Okay.
Yes, Dr. Rida.
Yes, Dr. Ahmed, you can speak.
I have one comment only. Yes. I know Dr. Dawlat is the first time to have this such speaking session. But I recommend her to be more, to provide more, to be more empathetic with the patient or the son of the patient. Just in the way of to tell him, don't worry, we are here to do the best for your father. And when I tell you that I will not prescribe the medication, just from myself to refuse, only I am seeking to do the best for your father. Okay, if I give this medication for your father, there is two things. I will be against our guidelines and protocols and may put your father at a risk. The other issue, I have to examine the patient firstly to put the proper diagnosis and the proper management for your father's condition. Just try to convince in an empathetic way. This is my notice here.
Okay, I will.
I'm totally agree with Dr. Ahmed.
Okay.
Yes.
I will tell you something, guys. Okay. First of all, Dr. Dawlat, I will give you some comments. Please stick to the simulation. It will be just a simulation, okay? Okay, it will be just a simulation and you have to be part of this simulation, okay? You have to sympathize by many different sentences. Like, I really appreciate your fears. This is the first sentence. Second sentence, don't repeat the same sentence. Don't say, I really appreciate your concerns. No, this is first of all, okay? Second, in sympathy, you have to show intonation of the language, okay? You have to say, I really appreciate your concerns. You have to feel this sympathy. Otherwise, you are joking, okay? I'm not telling about how to deal with a patient. Even he is a reluctant and he is angry patient, you can deal with him as a doctor. And you have to emphasize your information and paraphrase, okay? Don't read from the card. You have to change to these words to its synonym, like standards to be guidelines, whatever. You have to paraphrase words of sentences to be different. Okay, you have to tell him strongly speaking manner. Okay, you have to tell him, really, I appreciate your concerns. You have to be of high pitched voice because you are the leader of the conversation. You are the doctor. Okay, you have to speak like a doctor. Okay, you have to tell him according to the guidelines of care, according to the standards of care. It will be necessary to arrange a home visit for your father, and I will, or otherwise I can arrange an ambulance for transferring your father here on our hospital or our clinic. Okay, so all of this, try to change. Don't stick to these words and these notes. If you will give some excess information, it will be vital. No problem. Don't worry. They will make you. They will not give you a mistake, okay, or subtract from your marks when you exceed some informations. Okay, please be a high-pitched voice, lead the conversation because you are the doctor. The patient regarding Dr. Abdel Hadi, he was strongly speaking and he was angry. So you have to deal with this in a strong way, not a strong to argue with him or no. I mean that you have to show sympathy, but emphasize your informations, okay, and lead the conversation. You are the doctor. Don't forget, okay. This is the third comment. The fourth one is try to make one or two to three sentences, strong sentences to convince the patient. This is a real situation. If you would love during the conversation, this will subtract from you because you are a doctor and you are make fun of this patient. Okay, so this will lead to C in speaking. So please try to be strict, try to be of high-pitched voice, okay? Try to sympathize in different manners, try to lead the conversation. All of this will be assist, okay? You will tell him, your father really, I really appreciate your father's concerns, but according to the new guidelines or according to the guidelines, we cannot prescribe Banadine or Banadine Forte with warfarin, okay? As you know, this is our medical guidelines, so we have to follow strictly. So please, we cannot be forced to do something wrong. This will harm your father. Okay, speak like that, this, and ask him, is that clear so far? Are you following me? Do you think you can do that? Then present your piece of advice, like you will tell him, it's time to arrange a home visit. It will be a good idea to arrange a home visit, okay? Don't worry of your pronunciation. Don't worry of your faults, grammatical faults. Don't worry of all of that. I'm making mistakes during my speech, but I got B in occupational English test. And you all, inshallah, in speaking, you will get B. So don't worry. Try to write down these notes, okay, to avoid any mistakes, okay? We will leave the mic to Dr. Muhammad to comment. Dr. Muhammad. Dr. Muhammad Abdel Hadi, you can comment on Dr. Dawlat, then Dr. Dawlat can comment for herself.
دكتور رضا هو انا كنت reluctant كويس ولا المفروض ان الريلاكتنت بتاعي يكون اقل من كده؟
No, you were angry. No, you were angry, and we can even in MRCS communication skills or MRCP communication skills, you have to deal with all types of patients. Angry patient, even the patient can stand up from the chair and can argue with you. How would you suppose to deal with him? How would you?
The interlocutor can be يعني can be reluctant with me so tight ولا يعني هيبقى moderate?
No, he will not raise his voice. He will not be angry. Okay, he will tell you, okay, I'm not convinced, doctor. You can write me a prescription, and this would be possible for you to do. Why you are okay? He will be like this because he will not raise his voice or make with he will not shout. He will be reluctant in a modern way. But you were angry, and this you're right, I think.
What if he's strict to one clue? يعني I need the prescription. I need the prescription. He didn't move on. What should I do?
You will try to resist his reluctancy by variable sentences. Okay, I really appreciate your concerns. I will do that if this possible. Your father's condition is mattering. Whatever you will be variable, and at the end, even the time finished, it will not be a problem for you. So don't worry. My interlocutor told me, no, I am not convinced. I told him, actually, I made that. I told him, okay, no problem. I will see. After many times of reluctancy, I convinced him many times. So I get tired as a doctor and I have to be the leader of the conversation. I told him, I will see you. I will see you in a couple of weeks. And I would be, no problem. Okay, because you have to end up this conversation because I have another patients. I am not created for one patient. So you have to be the doctor, whatever. Try to be a real doctor. Don't worry.
اوكي
Okay.
طيب اوكي كان في دكتوره دولت اول ما سالتني قالت لي you are hurrying، ما سالتنيش what shall I address you. سكند ما كانتش في الاخر قالت لي ان هي مثلا في اللي هو عملت كلينيكال، يعني ما فيش اللي هو مش ريليشن شيب بيلدينج، ده كانت برضو ما عملتهاش. بعد كده في حاجه كمان اللي هي emphasize او مثلا summarizing. لو انا بسال مثلا في الانتراكتور بقول له مثلا كان I summarize في every use، لو هو ريفيوز بقولها وخلاص، ولا لا ما بقولش بقى خلاص، هو قال no فخلاص thank you and bye and I hope see you again.
Okay, first of all, we said that this is the first up visit, and you are he told you your name wrong. Okay, she should ask you about the name. This is right. In follow up visit, she's supposed to be know the patient, and she is familiar to the patient, so it's not necessary to ask about the name. Okay, so you are right. First of all, she should ask about the name. How can I address you? Okay, and you will tell her as you know. Okay. Secondly, to summarize the case, you should at the end. Do you have any? You will tell him. Do you have any other concerns? Okay. Okay. To summarize, we have been through the condition of your father, and I refuse to give you a prescription of Panadine Forte, and we will arrange a home visit. Do you get that, or did you get that, or are you okay with that? Whatever you will tell the patient. Okay, thank you, thank you. This is the end. It will not be a problem. You will not tell him, can I summarize for you? Or no, just try to tell him one sentence, one short sentence of summary. Okay.
Okay.
Okay. Now I want another two participants to be with me. Dr. Azhar, Dr. Ahmed Aid. Okay, Dr. Wissam.
Okay, Dr. Rida, I will be the doctor.
Okay, good. Good sign. Okay, Dr.
I will be the patient.
Okay, perfect. Okay, go on. You have 3 minutes from now to read the patient and the doctor. Start.
I'm ready, doctor. If you are ready, tell me.
I am ready, Dr. Nasser.
Okay, doctor. Good morning. I'm Dr. Azhar.
Good morning.
How are you today?
Welcome. I'm fine. Thank you.
Yes. I come today to tell you about the results of your blood sugar. Unfortunately, we find that your blood sugar in 2 tests are high.
Yes,
This
okay,
is
doctor, I know
confirmed.
that.
Yeah, this is confirm our diagnosis of diabetes mellitus. Do you have any information about this condition? Do you have any information about diabetes? Are you with me?
I don't know, doctor. Yani, what is?
Yes. First of
No,
all,
no,
I'm
no.
sorry.
I don't know. I know there is a term of sugar diabetes.
Yeah. First of all, I'm sorry
You
to
mean
tell
that I
you.
have that? I have the disease.
Yeah.
You mean that I have this?
Yes. I'm sorry to tell you that you have a condition called diabetes mellitus, which means that your blood sugar is high. Are you following me?
Yes, I'm following you. But how doctor tell me that I have diabetes? You only did only sample 2 sample tests. How you can be sure that I have diabetes?
Yes, I'm really appreciating your feeling, but two tests of high blood sugar confirm our diagnosis. These are the standards known by WHO or World Health Organization. Am I clear till
I'm
now?
not. I'm not believe in this diagnosis, doctor. I want more investigation to confirm that. Yani, easily told me that I have diabetes. What I do now, I didn't eat sugar, excess sugar. It tell me that I have diabetes, so I am not believe in this diagnosis. I want more investigations to do
I,
to confirm.
I can understand your feeling, but diabetes doesn't mean that you should eat much sugar. It sometimes happens to people who are not eating much sugar. Am I clear till now? Are you following me?
Yes, but still I ask you to do more investigation. I don't. Yes,
Yes,
I want more investigation, doctor. You will not do investigation.
yeah, I appreciate your worries, but there is no need in your condition to do more investigation because 2 tests are enough to diagnose diabetes. We want to start our treatment to avoid any other complications that can happen to you. Are you following me?
No, 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 doctor. I will not start. Till now, I didn't believe that I have this disease. So I will not
Yeah,
start the medication.
I can understand your fears, but delaying treatment in your condition can cause much complications to you, such as a blockage of the small blood vessels that can affect your heart or your kidneys. So first of all, we need to start our treatment. Then in the follow-up, we can do more investigation or more tests to check your treatment if it's going well or we need to add any other treatment. Am I clear till now?
Yes, doctor, but also I still now I will not start the medication except you do more investigation. What I do?
Yes. So for your condition, we cannot. There is no need to do more tests. If you are insisting to do more investigation, I can arrange to a meeting with our consultant in diabetes clinic to explain to you more about your condition, and also if there is any need to do any other tests, he can discuss with you.
Okay, in this way I'm agree. Yes.
Yeah. But up till now, we need to start our treatment for your condition because it will benefit you. Delaying of your treatment is not good for your condition or for diabetes. Am I clear till now?
Yeah, doctor. You promise me you will send me to your consultants. So in the start, I will start the medication, but I want more clarification of the disease and do more investigation, please.
Yeah, I understand your worries, and you should take care of your food also or your diet. I can arrange to you a meeting with dietitian. He can explain to you more about the recommended diet that you should follow. Also, you can try to decrease your weight and make more exercise. Am I clear till now?
Yeah, yes, doctor, yes.
Do you have any more questions?
No, thank you.
So I will summarize to you what we are talking today about the results of your blood sugar, which revealed that you have high blood sugar in two tests. This means that you have diabetes, and according to your
We
condition,
have
we will
finished,
start our treatment. Thank you.
Dr. Azhar. Thank you. We have finished.
Thank you.
Okay. Anyone has any feedback? I will start from the beginning by Dr. Ahmed Aid. You will please comment on Dr. Azhar. Dr. Azhar's give her a feedback, please. Okay.
Yes, Dr. Azhar did it very well, Dr. Rida, today. She covered all the aspects of the task. And at the end, she make me agree for starting the medication and the treatment plan.
Okay, very good. And Dr. Azhar, please comment on Dr. Ahmed Aid.
He was very difficult patient, really. He was not convinced easily, and he put me in what I mean. He didn't give me any more choices other than I should refer to my consultant. And I don't know if it's right or not, but I take it from my previous experience with MRCP. I don't know if it's right or not.
Not a problem. By the way, we have said any excess, any medical excess or medical terms will not deduct any marks from you. Okay, you have to go like we said from the beginning. He will tell him his concerns, and you will tell him, sir, sympathy, information bullet, and reassurance that he is in good hands. Then you will tell him the synonyms of these words. Try not to use the same words even in the task note. Okay, try to paraphrase. Try to pronounce some synonyms. Okay. Then every 2 to 3 sentences you have to check understanding like you have done. Okay, I think your levels, Dr. Ahmed Aid and Dr. Azhar, your level is going up. Okay, because in the 2 weeks ago I met with you, your level was not like today. Okay, so you are perfect. You have done almost good. Okay. After try to use. I told you to use some synonyms. Every 2 to 3 sentences, you have to check understanding of the patient. You will tell him, "Are you following me? Is that okay with you? Do you think you can do that?" Whatever, you have to be variable and ask him, "Am I clear so far? Is that obvious for you?" Okay. And try to be reluctant with him to understand the fears of try to. I really appreciate your fears. I really appreciate your concerns, and try to be variable in mentioning these sentences. Okay, at the end, you will tell him, "We have been through the situation, and do you have any other concerns? Thank you, thank you. No problem. I think by this way you will be in speaking, inshallah. Even the patient is reluctant and your time has finished, definitely it will not affect your level, because you are a doctor. You have to be patient with your patients. Okay, so I will do another role play card with another 2 participants. Okay, please raise your voice. Dr. I don't think WHO core. Who are you?
Omar. I am Omar. My name is
Dr.
Omar.
Omar. Okay.
Hi, Dr. Reza.
Welcome, Dr. Omar. Okay, you can be the doctor or the patient.
I would like to start with the doctor.
Okay, perfect. Okay, we need a patient. Dr. Wissam, Dr. Mustafa Ibad, Dr. Mustafa Ahmed. Okay, here I can do it. Dr. Mustafa Ahmed. Okay. Dr. Mustafa Ahmed, unmute. Okay, you are unmuted now, Dr. Mustafa.
Okay, Dr. Reda, thank you for the meeting, and I can be the patient too.
Okay,
No
Dr.
problem.
Mustafa is a patient and the Dr. Omar is the doctor. Okay, you have 3 minutes from now. Then it will be shifted to the conversation. Okay, go on.
I'm ready, Dr. Muhammad or Dr. Mustafa. I'm ready.
Okay, I'm ready to.
So, good morning.
Good morning.
Nice to you. How may I address you?
It's Mustafa.
Sorry. I am Dr. Omar, your treating doctor. How may I address you?
It's Mustafa, doctor. Nice to meet you.
Nice to meet you. So, first of all, I would like to comfort you that you are in a clinic where the doctors are professional, and we are trying to make benefit to your case. So, can I know your complaint?
Well, doctor, I have a lot of stress in my life. You see, my mother-in-law has been diagnosed with Alzheimer recently. So she came and stayed with us, and I have a lot of trouble sleeping, and also I have a lot of trouble in work. So I guess I came for you to perhaps prescribe me a sleeping pill or something to help me to sleep.
Okay, to make it clear, first of all, I appreciate your feelings and I appreciate your worries.
Thank you.
But concerning the sleeping pills, I cannot prescribe to you the sleeping pills. You may have some queries about this, but I assure that it can make some undesirable side effects like dependency and some
No, doctor. I don't feel I am that person. I am a very independent person. I can take care of myself. It's just for this period of time. I need something to help me to sleep. Why are you denying me this right?
we can first try some natural methods or alternative methods rather than the pills for your anxiety. You can try self-care techniques and dietary measures. Some exercises will relieve your anxiety. These are all alternatives for the sleeping pills.
Yes, doctor. I have tried all of these measures, but nothing is working. I am afraid if I still get no sleep, I might get divorced or perhaps lose my job or something.
Okay.
You have to help me.
Yes, I'm here to help you, and I'm here to make any method for helping you. But first, you have to help yourself. Have you tried? Have you heard about the some sleep hygiene manners, some sleep manners and stress management techniques, like focus on routines? Sorry, like natural rhythms.
Doctor, why are you denying my request? I need a sleeping pill.
I'm not denying your request. I'm hearing your demand with much concern, but it's
Then
not a matter.
prescribe me.
It's a matter of your health. So if you have many alternatives rather than the sleeping pills, we should first, according to the guidelines, start by these alternatives and make the sleeping pills our last choice. So have you tried some making your sleep environment more restful and some natural rhythms in your life? And have you tried other to change your daily routines? Have you tried this first before you requested the pills?
Well, doctor, I have tried
Or
some of
you only
these.
came to?
I have tried some of these, but you can tell me more about some successful method. I will go with you.
Okay,
You can advise me.
So we can set an appointment with the psychologist or higher counselor for your case. So we can arrange an appointment for a further consultation in the psychologist clinic. Would you help me to do this? Can you do this?
Okay, doctor, no problem.
Okay. Do you have any other questions?
When will be this session?
Maybe I will arrange with the clinic, and I will tell you. I will see you in. I will always be in contact with you.
Okay. Can you prescribe the pills after this session?
We should first try all the available methods and all the alternative methods for the sleeping pills. As you know, its side effects and its harmful effects. But if we can,
We have finished. Doctors, please, we have finished.
Thank you, doctor.
Thank you.
Thank you.
Okay. I ask you, one gives the other one as a feedback. Dr. Omar give Dr. Mustafa as a feedback.
Um, Dr. Mustafa was very flexible, but at first he was strict to his idea and to his request for the sleeping pills. But at the end, he became very flexible for my advice. Very good.
Okay, thank you, Dr. Omar. I would like to give you a few comments, if you please. Well,
Of course.
you did great in the card, but I think you have to manage the concern of the patient. You have to address the concern. You kept telling him that it's not for your health, but you have to explain. Tell him that I appreciate, show more empathy. Tell him that I appreciate your it must be a very hard time for you. I appreciate that you are seeking a fast relief or something, but this can cause bad impact on your health, and later on it have many side effects. For example, 1, 2, 3. You have to every time give him another option why he doesn't suppose to take the pills. Just do not deny him the pills, and don't go for the next option until you satisfy his need and manage his concern, because you can't ignore him. You kept telling him that there are other techniques and you have to go through the task in the card, but first of all you need to address his concern first, and once you are agreed upon this, you can then take him to the next level. I can help you. I'm here to help you with other methods like stress management techniques and so on. Other than that, you are dealing with the card, and Dr. Rida can tell us more.
Thank you, Dr. Mustafa.
Thank you, doctors. I think you have done good, but you have to be active more than this. You both of you, okay? You have to be active. I think you made it well, okay? You made good efforts, but you have to be like, no, you have to and show sympathy and show you have to be interactive more than this, okay? Because no time for you to be relaxed, okay? No time for you to be slow. You have to be active, speaking rapidly, because you have to finish all of this, okay? You have to end your task and you have to practice with less than 5 minutes to finish all the task, okay? And manage all reluctancy items of the patient, okay? So try to be interactive, try to be rapid, go for practicing, and I think you have done good. I will not comment on medical or pronunciation. I will just comment on the flow rate of the conversation, and secondly on the intonation of your voice. You have to, I really appreciate your concerns. Oh no, this will not be a good idea for you, but let me to, like, intonation, raising and decreasing the pitch of your voice while speaking. This is called the intonation, and will give you a very, very very good marks in your exam. And I repeated this more than once. You will get B in speaking, inshallah. Okay.
Thank you, Dr.
Omar. Thank you, Dr. Mustafa. Okay. We have Dr. Wissam, Dr. Mustafa, Dr. Muhammad Hamdi, Dr. Muhammad, Dr. Ahmed Aid. Okay, we have all. Dr. Wissam, if you want to practice, or Dr. Mustafa Ibad, if you want to practice with us, we are ready. Okay, we can flip to the next.
I would like to be a doctor. I would like to be a doctor.
Okay, you want to be a doctor? Okay, you are Dr. Mustafa or Dr. Ahmed? Dr. Omar? Who is speaking? Sorry,
No,
who?
it wasn't
Dr.
me.
Omar, you want to be a doctor?
No, it wasn't me who were speaking.
Dr. Ahmed or who? Dr. Ahmed Aid, do you want
Yes,
to?
yes, Dr. Rida. To be a doctor, yes.
Okay, you can be the doctor with me.
There is
Okay,
some
we have.
interruptions. Internet also.
Okay, I will be the patient for all, and I will give comments and will be live with you to give summarizing what we have mentioned in the beginning of our lecture. Okay, I will be the patient. Okay, Dr. Ahmed Aid.
Okay, okay. What is the task, Dr. Rida?
It's in front of you on the screen.
Ah, yes, yes.
I'm ready, Dr. Ahmed.
Yes, I'm ready, Dr. Rida.
Okay, I will adjust the timer. Okay. Okay.
Start.
We can start now. Okay.
Good morning.
Good morning, doctor.
I'm Dr. Ahmed Aid. I'm the treating doctor today. Please, how can I address you?
I am Mrs. Leslie, 32 years old.
Welcome, Mrs. Leslie. Nice to meet you. I know that you have some concern regarding your ears. Can you tell me, please, what's your concern?
Really, doctor, I have a painful, I have severe agonizing pain in my left ear.
Yes, I'm sorry. I appreciate your feeling a lot, and I know it is difficult for you, but don't worry. Please let me firstly to examine your ears. Okay, is it okay?
Okay, no problem. Okay.
Okay, Mrs. Z. After examination of your ear, I saw that you have a condition which is called otitis media. You understand me?
No, doctor, actually, I don't know what's the meaning of this term.
Yes, okay. Let me to explain it for you. Otitis media means inflammation in the middle ear. Okay?
Okay.
This inflammation, yes, this inflammation occurs when a bug or a bacteria infect your ears, which leads to inflammation of the middle ear, the middle part of your ear. When become inflamed, there is possibility of being formation of a substance which is called the pus. Do you know pus previously?
Yes, yes, doctor, yes.
Yes. Usually, when there is a pus inside the ear or in a part of the body, it will give you to feel severe aches or feeling unwell or discomforts. Okay?
Okay, doctor.
Has it happened with you before? In this disease?
Yes, actually, doctor, I have. I first noticed this pain 3 years ago, and I really I have tried paracetamol, but the pain.
Yes.
Yeah.
Yes, I really appreciate your feelings. I know it is difficult for you nowadays to cope with this condition, but I would like to reassure you, firstly, that it is a common condition in our practice to happen with many patients, not you alone. This condition needs only to be managed in a smooth and easy way, including giving you a course of antibiotic. It will be from 7 to 10 days. After that, there will be no problem for you. I forget also to tell you, when there is a pus inside the ears, which means when you felt it, after some while there is perforation inside the ear, and the pus is expressed outside. Did you notice there is expressed liquid coming from your ears outside?
I will be a deaf. Oh, I'm really scared of this. What happened?
No, don't worry at all. I'm sorry to hear that, but Miss Lizzie, don't worry about this condition at all. We will help you to be completely get rid of from this condition by taking this course of antibiotic. Your ear will be very good. We will assess your condition and we will also make follow up after finishing the course of the antibiotic, and also will give you an evaluation of ideological assessment after finishing. Is it okay? You can understand me?
Okay, but I will. Would this affect my hobby? Because I'd like to go scuba diving.
Yes, no problem. It will not affect your hearing. Luckily, this condition very good outcome after sticking with our proper guidelines and the treatment. But my advice to you to avoid diving or anything which make increasing the pressure over your ears at that time. So avoid diving, aircraft flights, and avoid anything water coming inside your ear during these periods, which makes the pressure increase inside your ears. Okay, this is transient.
Okay.
You understand me? Am I clear so far?
Yeah, I understand, but I think this gonna affect my fitness to dive because I cannot understand.
Yes. I appreciate your concerns a lot, but this is transient condition. After complete our course of treatment and be sure that you are completely free. After that, you can practice your life as usual and practice your sports.
Okay, doctor. Okay. Thank you. Okay, doctor.
Okay. You have any concern, Ms. Lizzie?
No, doctor. We have finished our 5 minutes. Okay.
Okay. Thank you very much. Thank you, Ms. Lizzie.
Okay. Thank you. Okay. I will give some comments. Okay.
Yes.
You are good, but you have to do only 2 sentences. Only 2 sentences. Don't elongate the conversation. Like, you will tell me, Mrs. Leslie, don't worry. This we have made the diagnosis of otitis media. Okay. Otitis media means inflammation of the middle ear. Is that clear for you so far? Okay.
Yes.
And okay, so don't try to be. You have 5 or 4 tasks to finish. Okay. So try to finish them all. Okay. Don't try to elongate 4 sentences and don't check the patient understanding. Okay.
Yes.
After giving the treatment, you also should say treatment in short and then ask the patient Do you think you can do that? Is that okay with you? Does it sound good for you? Does it sound good for you? Okay. Uh, will it be easy for you to do that and like this? Okay. Okay. And every time you can sympathize with the patient, like, I really appreciate your concern, and change fearing, not fearing. I really appreciate your fears, or I really appreciate your your words. I really appreciate your concerns. I have never heard one saying fearing. Okay, not fearing, fears, or worries or concerns. Okay, you are good.
Yes.
You have done great, and your level is good. Okay.
Thank you, doctor. Thank you.
Thank you, Dr. Ahmed. You have done good, and your level wasn't like that. You are good. Okay, go on.
Thank you.
Also, Dr. Azhar, you are great. And also, Dr. Mustafa, Dr. Omar, you have done great. Thank you. We have done for today.
Thank you, Dr. Ridwan.
Thank you. Goodbye, Dr. Omar. Goodbye, Dr. Ahmed.
شكرا
Goodbye,
دكتور.
doctor.
Goodbye.
Thank you.
Thank you, Dr. Mustafa. Thank you.